hurts my back.
Go live there. And we will go live here. So many going live places. See if we got it. There we are. So, welcome to the 7 o'clock talk. I'm Dr. Trevor Miller. This is my wife, Jessica Miller, who is an RN. And we have been told to make sure that we give you our credentials. I have been a chiropractor since 1995. I've been in the functional medicine field since 1996. And that deals with my daughters that were born with mitochondrial disease. And from then on, it was always, how can I do something to help them? And then it just spilled over into the patients. How do I help patients? Because we're seeing more and more and more sick people all the time. And as for you, you are a nurse. You tell them your stuff.
It's not really, there's nothing really to tell. I was a registered nurse. I've been a registered nurse for about 14 years. Acute med surg, emergency room, ICU.
And so she has a lot of practice dealing with people and patients. And she helps with the hormones, or does basically the hormones. And she also does patient education. I deal with a lot of reading of the labs, and I set up the programs, and then we start to execute that with the patients. And so tonight, our talk is, we were asked, hey, would you do a What's Up, Doc? And discuss chronic pain. And that's really hard to do in 15 to 20 minutes.
Yeah, there's so many cans we could open with that.
Yeah, that is such a multifaceted problem. I mean, all the way from looking at the inflammasome and the interleukins, and we'll have a short video here to explain the interleukins in the inflammatory process. But right off the bat, our first thoughts were going back to hormones. And so if somebody has chronic joint pain, what's the first thing we start looking for?
Well, I always think of to check their hormones to see if their testosterone's low. Because a lot of people that wake up in the morning, they have to warm up and they get their feet on the floor and they just are achy. A lot of their feet, that's the dog.
Yeah, I know. I'm trying to keep Libby from...
A lot, especially pain in your feet. It's usually can be associated with hormones. And that is if you don't have any other thing going on that you know of.
So the first place to look is, what are the hormones doing? And then as we followed up, last 4 weeks for the last month, we've been dealing with the Dutch Plus. And you want to look at cortisol and stress, because cortisol and stress can affect the thyroid gland. And then that'll give you problems with your cholesterol. That can give you problems with all your sex hormones, and it can also cause gut problems. And then once again, if you have high cortisol, or if your cortisol is exhausted, then you will no longer produce secretory IgA. And so when we go to look at how the gut and problems in the gut, we had this just the other day where a gentleman was like, I don't have any gut problems, but he had a lot of pain. And so we were like, let us show you a short video. So we're going to show you a short video from Microbiome Labs. It talks about how that can be a problem.
This is a full schematic of a healthy intestine. A healthy intestine should include abundant keystone bacteria, limited pathogens or potentially harmful strains, and strong physical barriers. A healthy gut microbiome should have a high abundance of beneficial bacteria that can limit the overgrowth of unwanted pathogens.
So when we're looking at this, what Kirsten is looking at is right here. All of these little bugs in here, that is known as your microbiome. And then the layer right below it looks like an ocean or water. That is secretory IgA. That is the slime layer. That is the first layer of defense. Think of it like flypaper. And then you get down into the crypts and the villi of the gut. That looks like the big, earthworm thing looking there. He'll go into that more, but that's the last physical barrier. And so when you're talking about chronic pain, a lot of times there's a breakdown of this. Let me fire it back up.
These beneficial microbes help protect the integrity of the intestinal barrier by producing short-chain fatty acids like butyrate. Butyrate and other metabolites help maintain a strong mucosal barrier that helps shield the intestinal cell lines from damaging toxins and pathogens. Additionally, butyrate can reduce intestinal inflammation and improve barrier function by maintaining the tight junctions that hold intestinal cells together. A disruption in this ecology, where beneficial microbes become outnumbered by potentially harmful bacteria, is called dysbiosis. Dysbiosis is driven by these main factors.
And so as we look at each of those factors, stress is one of the first things that we look at because it degrades that mucosal barrier and it starts to change the microbiome. And you've heard us in our past talking about short chain fatty acid producing bugs. When I show you the GI map coming up here, that's what we're talking about. These are the bugs that you have to have so that you can replace that slime layer. Antibiotics kill off all bacteria, both good and bad. So you have to come back in and replace what you have destroyed. Pathogens are bugs. Pathogens in our world is biofilms. So this is when the bugs that have degraded, well, let's continue on and then I'll stop here in a second.
As the microbial population becomes unbalanced, unwanted pathogens begin to degrade the mucosal barrier.
So when these pathogens degrade this mucosal barrier, this is where you'll see here in a minute where they go through, called paracellular, through there, but bacteria will start to form biofilms on this. And so if you have somebody who takes antibiotics, gets better, then 3 to 4 to 5 days, gets worse again, and then they go on another round of antibiotics, and this happens over and over and over again, you're dealing with those pathogens called biofilm.
If the mucosal barrier is not intact, toxins can migrate towards the intestinal cells, inflicting damage and creating inflammation. As tight junctions loosen and break apart, this creates gaps in the intestinal lining that allow toxins to enter circulation.
What's the number one thing we talk about that causes that barrier breakdown? Something we eliminate in the diet, the biggest thing.
Gluten.
So gluten makes the body release an enzyme called zonulin, and zonulin makes that tight junction open up.
Relaxes it.
Yep, because you got to clear gluten out.
This migration of toxins from the intestines into circulation is called leaky gut. Leaky gut is a self-perpetuating problem, affecting at least 50% of healthy Americans, as it can trigger chronic inflammation throughout the entire body. This inflammatory cascade starts with a toxin produced within the gut itself called lipopolysaccharide, or LPS. Circulating LPS gets bound by a transfer protein called LPS binding protein, or LBP. LBP carries LPS to the CD14 toll-like receptor complexes on the immune cells, like macrophages and dendritic cells, which then activates the NF-kappa B inflammatory cascade.
So before he goes on and explains a little more, the thing I want to take a second and talk about here is, at this point in time, you have a very active immune system. And that's where your arthritises can come in. This is where chronic joint pain really comes into play, because now the inflammatory cascade, that TNF alpha, interleukin beta, interleukin 6, all of these things are in circulation, and it causes the inflammatory response, causing pain. Here, I'll finish.
The activation of NF-kappa B increases the production of pro-inflammatory mediators like TNF-alpha, interleukin-1 beta, interleukin-6, and MCP-1. This is the same exact sequence that occurs in sepsis, also known as blood poisoning or septicemia. Immune cells that become activated by LPS and release pro-inflammatory cytokines exist in all parts of the body and are capable of crossing the blood-brain barrier. Therefore, the inflammatory response can occur throughout the body, including the brain, fat stores, nerves, joints, and more. This type of inflammation is a breeding ground for a variety of chronic illnesses. Reversing the dysbiosis and the damage to the intestinal barrier is paramount to health and wellness. Thankfully, there is a solution to the problem. Ask us about our total gut restoration system today.
So that is how you can have leaky gut, but you won't have any gut issues. But you can have arthritis that flares up. Think of it this way. If you eat a tomato, do your joints hurt? That nightshade is getting into the nightshade fruits tend to cause arthritises to flare up.
Lectins.
Why? Because these things are allowed to get into circulation because of basically a mucosal barrier that is weak. To add to this, if you go long enough with these things, then we start to see a change in the microbiome. And this change in the microbiome, remember where he was talking about the short chain fatty acid producing bacteria? These are keystone species. These are the species that start to produce the short chain fatty acids, Akkermansia, Faecobacterium, and Roseburia. Those three primarily repair the leaky gut. And this person doesn't have the ability to fully repair that. So they go through and they have aches and pains constantly. Then another thing to pay attention to is, see this Bacteroidetes and Firmicutes or Firmicutes? What happens here is the Firmicutes are inflammatory. They are part of the inflammatory immune system. And the Bacteroides is anti-inflammatory. So if your ratio of 2-to-1 is off and your Firmicutes gets higher, then your immune system is a lot more active, causing a lot more inflammatory response and inflammaging and arthritises and things like that. So you don't want that to happen. And as these things break down, then it allows bacteria like these. Remember when we were talking about the pathogens? When these are high, they form biofilms. So this type of person with strep, a little bit of staph is there, but the Bacillus species, the Enterococcus species, those all form biofilms. And when they're present, they will reinfect and reinfect and reinfect. So people can get to where they feel pretty good for a while, and then they're the person that a stress hits their life and they just fall apart. Oh, when it rains, it pours. Oh, this is happening to me again. Oh, blah, blah, blah. That is where we start to look at that this person has biofilms. And so then you want to start to go through the process of eliminating those biofilms. So when we look at what's up with your chronic pain, as you can see, there's a lot to it. Now, we can do a Band-Aid. We do quite well with people with using a product called Ultra Inflamex 360. And people absolutely love this to help control their pain. But if you don't get rid of those bacteria and you don't get that dysbiosis taken care of, it comes back. It goes right back to that pro-inflammatory profile. And so, there is no easy answer, and there isn't one answer. I mean, if you think about it, I've been doing this a long time. And every time pharmaceuticals come up with the next latest and greatest, it always causes damage. In the 80s, or sorry, in the late 90s, early 2000s, we had the COX-2 inhibitors. And Celebrex is the next latest and greatest thing. But then people started having heart problems because you have a COX constituent in the heart. So, those work on inhibition. What we do does not work on inhibition. We want what's our primary mode of action, Dave?
Changing the diet.
And working on promoting the body's own natural resources and healing.
Giving the body the things to heal itself.
And so you have to have a diet that has plenty of polyphenols and plenty of bioflavonoids to help shut the immune system down when it's done doing what it's supposed to do. Because if you don't do that, then yes, you have chronic pain, you have arthritis, you have knee pain, joint pain, hip pain, back pain. People get back pain all the time. And, you've got to start to differentiate that. Is that a kidney stone? Is it a disc issue? Is it a muscle issue? So when you're dealing with chronic pain, it's not always best just to take something and cover it up and wait to see what happens. Because usually by the time you wait to see what happens and those things don't work anymore, permanent damage has been done. So we are here to help you. If you have chronic pain, do the hormonal profile. If it's the hormones, that's the easiest one to start to address. Not easy to fix, but it's easy to address. And then after you address the hormones, then you start to address things in the diet and look at the microbiome. And that's what we specialize in. That's what a lot of functional medicine doctors really work at. We tend to have a system to do it. And that system seems to bring us patients from other functional medicine doctors. Because we're basically referral. We do these education pieces, and then it's all referral based. So we're here to help you, and we will see you next week. Thank you.